sclerosis, or what we call ALS. ALS is a group of rare neurological disease that involves nerve cells, or what we call neurons. Neurons are responsible for controlling voluntary muscle movement. It is also belongs to a wider group of disorder known as motor neuron disease, which are caused by degeneration and death of motor neuron. ALS is also where there are weaknesses in the limbs and muscles in order to move, breathe, eat, and speak. Both categories of upper motor neuron and lower motor neuron. It also may start spreading in upper or lower extremity than other body parts. It also affects the spinal cord and nerve cells in the brain. ALS also means it's unable to function, which means the muscles gradually weaken, start to twitch called fasciculation, and waste away called atrophy. Brain loses its ability to initiate and control voluntary movements. Most people with ALS die from respiratory failure, usually within 3 to 5 years from when the symptoms first appears. However, about 10% of people with ALS survive for 10 or more years. General information of ALS. It is a progressive nervous system that affects nerve cells or spinal cord. Upper motor neuron extends from the brain to the spinal cord, while lower motor neuron extends from the spinal cord to the muscle. ALS also causes dysarthria or impaired motor speech disorder caused by weakness or paralysis of the muscles. Also, it makes speech slurred as well as articulation, prosody, and respiratory support. ALS has no cure or no effective treatment to halt or reverse the progression of the disease. This disease meaning that symptoms are gonna get worse over time.
Amyotrophic lateral sclerosis is a group of rare neurological disease that involves nerve cells that are responsible for controlling voluntary muscle movement. Now I'm going to be talking about the anatomy of the neuron, but it's more specifically to more neurons, as this is related to ALS, which is, as you can see in this image, it depicts a whole generalization of the central nervous system, and ALS is part of the central nerve. Based on AR's condition, his participation is affected, so it would be through his home socializing, so meaning he has angriness.
Case study details. AR is a 58-year-old male working as an agent of real estate. He is right-handed and recently he has been diagnosed with ALS. His father also diagnosed with ALS. He has hypertension which is controlled by the medication. About 1 year ago, the first symptoms started such as slurred speech and mild swallowing problems. Also, clumsiness when buttoning the shirts, muscle cramps in lower legs, and balance or stumbling problems. He is finding the physical demand to climb the flight of stairs up to his bedroom and office. Also, when carrying groceries from the car. He is losing weight because he's not eating much and also reports muscle spasms in both arms and legs upon waking in the morning. Currently he has slurred and slow speech, muscle atrophy bilateral lower extremity and upper extremity muscles. He has passive range of motion within full limit. Bilateral lower extremities are weak, grip strengths are decreased bilaterally, and sensation within full limit all four extremities. He is independently transferred with slow speed. When ambulating, he is doing bilateral step-page gait without any mobility aid. He needs wide base of support, and during ambulation assessment, he almost fell. He needs supervision when climbing stairs with one handrail with step-to pattern. Patient seems to be in denial of diagnosis, although he saw his father die of ALS. He's angry when therapists suggest a gait aid. He's feeding independently and dressing independently with extra time out of teeth clothing to avoid fasteners, not able to safely transfer in and out of the bathtub, but he refused to use tub transfer bench. Physiotherapy long-term goal: independent stair climbing with handrail and single-point cane in 3 months. Occupational therapy long-term goal: promote environmental adaptation to maximize functional independence in 3 months. General clinical features of ALS. 1. Breathing problem because of the muscles are paralyzed, which is using tube breathing. 2. Difficulty with walking or doing normal activities. 3. Tripping and falling. 4. Weakness in leg, feet, ankles, and hands. 5. Muscle cramps and twitching in arms, shoulders, and tongue. 6. Trouble with eating or swallowing and slurred speech. 7. Inappropriate crying, laughing, or yawning. 8. Cognitive behavioral changes.
Clinical features of ALS specifically in the case study. First, clumsiness. Second, muscle cramps in lower legs, balance, stumbling problems. Third, slurred speech. Fourth, mild swallowing problems. Number 5, losing weight because of not eating much. Number 6, passive range of motion within functional limit. Bilateral lower extremity are weak. Next, bilateral grip strengths are decreased. And lastly, sensation within functional limit of all extremities. Next, we're going to tackle about the activity limitation of ALS specifically in the case study. First, can climb up the stairs. Second, slow in performing activity of daily living. Third, can go to work. Fourth, can play sports. 5, can communicate well because of slow speech. And lastly, can't run. In addition of the activity limitation of ALS, specifically participation, are socializing or like eating dinner with family, eating dinner with friends. Second is able to drive car. Third is working in the office and as well as going to school. These are caused by the gradually muscle weakens like muscle spasm, twitching. This is why it's really hard for ALS patients to do their ADLs, or maybe they can do the ADLs but it's very slow, and most of them cannot go for socialization, maybe because of the fears of not communicating properly. Here are the references where you guys can all get the information that we saw, and for better understanding, you guys can search it anytime, anywhere. You can use your phone, laptop, so that if ever that you didn't understand anything, you just guys can search it, as well as we put all the references, like literally all the references where we got all the information that we put here, so that you guys have the access. Thank you so much for listening. Hopefully, you guys learn from this video that we shared. It's our pleasure to share this kind of information or videos to you guys, so that everyone will have a better understanding of ALS condition. And once again, this is me and my team, Team ALS, Jovi, David, and Yuen.